Let y'all hop on with us here. If you join us, please say hello. Let us know where you're watching from. There they are. Hi, Lori. And Lauren.
That little was just messing with me. There we go. All right, everyone, we're going to go ahead and get started. We have a special guest with us today. Dr. Eric Moore is with us from Norbrook, and him, along with Dr. Tony, are going to talk about the spring cattle health, and they're going to focus on pink eye and foot rot.
Make sure that you get any questions in the comments. At the end of this segment, we will be giving away to 2 lucky viewers some Normycin 300. So be sure to get any questions that you might have in the comments. And with that, we are going to turn it over to you, gentlemen.
Hi, folks. How is everybody today? So like they said, today we're going to talk about some spring and honestly some summer health considerations in cattle. We will focus on pink eye and foot rot, but there are a lot of topics that we can cover in this overall discussion. So we'd like to welcome Dr. Moore with us today, and he's helping us out from Norbrook, and they offer some excellent products for these 2 diseases. And I'll turn it over to Dr. Moore now if he has anything he wants to add at this point.
Thank you, Dr. Tony. Well, welcome everybody. We're glad to be here, glad to be a part of the presentation today. Hopefully you'll be able to walk away with a little bit of knowledge that you can use and help your production system get better in the process. So welcome any questions. Dr. Tony, we talk about the summertime, those production robbers, and that's really what we're focusing on today. Those are things that when we go to sell cattle in the fall, they have taken money out of our pocket. And pink eye and foot rot are 2 really big ones that we see. I've done some articles before on the big 4: pink eye, parasites, respiratory disease, and then calf scours. If you have any of those in your operation in the spring, it costs you in the fall, right? And those are ones that we see and that we deal with. So we really talk a lot about treatment with pink eye. The key is we want to prevent it to begin with. And I'm sure everyone on here has a good relationship with a local veterinarian. They can help get information they need locally. I see we have people from South Dakota, South Central Kansas, Missouri on the line. I know there's some friends of mine from Texas. So, all around the country, we'll talk about general disease processes that will fit where you're at. But you also remember there's some nuances by where you're at, by your location too, that getting that local help is critical to be beneficial to your herd.
Yep. And I'll echo what he said. It's very important to have that relationship with your veterinarian. If you need prescription items or just that personal help, it's essential. So Dr. Moore brought it up, and it would be prudent to go ahead and talk about how we prevent these diseases from happening. Pink eye is tough. There's really no golden bullet, silver bullet when we're talking about preventing pink eye. In the classic sense, pink eye is an infectious disease. It's bacteria, certain viruses that can get into that eye, the conjunctival surface, and cause that ulcer to form in that eye. Can cause ugly scarring. It can even cause loss of the eye, loss of production, decreased grazing time. So it's not a fun disease, and it is difficult to prevent. Vaccination is one big tool in our tool belt. It's not a perfect vaccine. It does help, but it does not prevent 100% of the cases. Irritation to the eye from long grass, trees, sunlight, that's going to help precipitate this disease taking hold. So we want to make sure we practice good brush management, good grazing management. That's very, very important in minimizing the impact that pink eye has. And then obviously a huge part of it is fly control. We need to control those pesky phase flies because they irritate the surface of the eye, and they also spread those bacteria that can cause pink eye. So those are three big areas that we need to focus on in trying to minimize or prevent pink eye from taking hold. Dr. Moore, if you have any more to add to that, feel free to jump in.
Dr. Tony did a great job hitting that triad, right? The animal, the bug, and the environment. And so when we talk about the triad of pink eye, the animal has to have the immune response to protect itself. The environment with both flies and brush, as you've talked about so well, can be there. Anything that creates that little crater in the cornea, I call it the bacterial foxhole that takes the tear film out, doesn't wash it away. It is absolutely what we're trying to prevent, and flies are a big part of that. Whenever they feed, they put a little hole, their feed pokes a little hole in that cornea. So that's a perfect, you've hit all the high points. And so when we talk about prevention on the animal side, we're raising those antibodies that are in those tears that come and protect the eye. But the other thing is when you talk about treatment, if we do get a case of pink eye, is getting a product that gets into that lacrimal gland, that gets in that tear film to hit that bacteria we talked about that's in the eye that's secreting enzymes that's breaking down that cornea. So that's all critical in the disease process. I think one thing we really need to talk about and make people aware of is that progression of that disease. You mentioned it, you're spot on. Those white scarred eyes not only hurt. My wife is an optometrist, and she tells me how painful pink eye is and corneal injuries are in humans. So we know that that's going to hurt that calf, and that's going to drop its weight gain. There's been studies older studies looking at weight loss from dual cases of pink eye on calves coming off up to 125 pounds lighter off grass. And so think about what that does to your pocketbook. Can you take a calf out there and drop 50 pounds, 30 pounds, 20 pounds from your genetics that you paid money for? What does that do to your pocketbook? And so it goes back just to treat them early if they do get it. I think another point you brought up well is that we have a hard time preventing pink eye. I mean, it just seems to run through a herd. I mean, you've seen it and I've seen it where herds will have it year after year, maybe get let up a year because they've got some herd immunity from the bugs they're fighting, and it's been a wetter year and there's not much as trauma to those eyes. And then the next year they'll have it right back again, and so if we get to that point, we can talk about signs, clinical signs, progression of clinical signs, and when you need to get in there and treat, and how you pick it up early. I mean, because the big thing is going to treat pink eye, which, by the way, is the number 2 leading disease issue in calves behind BRD. Respiratory disease through that calf's life is going to be the biggest problem across our national herd that we have. Pink eye is number 2. So to tell you where that's at in importance. And so maybe we can go back through, Dr. Tony, and just give them the progression of disease as we see in there so they can pick it up earlier and have better success. Yeah. Unless there's anything else we need to cover on prevention. Starting with prevention, talking to your local veterinarian, looking at your vaccine options, looking at brush control. Anything else we left off on that, Dr. Tony, that we need?
I don't think so. I think so. Fly control is tough.
Yeah.
It might be worth bringing up a little bit. Face flies are hard to control because they don't spend a whole lot of time on the animal. And so our insecticides don't provide great control for face flies. So we have other options that seem to work better than like fly tags and animal sprays. One product that we have that has gotten a lot of good feedback is a mineral feeder cover that has a felt underside that soaks up that insecticide concentrate mixed with oil. And every time those animals lift that up to feed on that mineral, it coats that face with a layer of insecticide. So technically every day they should get a dose of insecticide to repel those face flies. And that has worked wonders on some herds that have had some year after year pink eye issues. So that might be the only thing I'll bring up. And then we can sure talk about how that disease progresses. Dr. Moore hit it right on the head. We need to treat these calves early. He brought up the impact this has on weight gain. And also if we get these scarred eyes, they're going to sort them off at that barn and you're going to get docked big time on that, which is unfortunate, but that's just how the industry works. So the earlier we treat them, the more likely we are to prevent that progression of disease and save that eye from having any kind of long-term effects. The first thing that we're going to see when we're dealing with pink eye is squinting and watering of the eye. And ideally, as soon as we see that, we should be getting that calf in, getting it caught, looking at the eye, seeing if there's any grass awns or anything in the actual eye itself. If we see that, flush it out copiously with an eye wash or an eye spray, and then give that calf an injection of an antibiotic. That's going to, like Dr. Moore said, travel to that lacrimal duct and provide a good dose for treating that pink eye. As the disease progresses, it's going to move to a little ulcer, which is, like he's mentioned, just a hole in the cornea of the eye. It starts out clear. You really can't see it unless you look closely. But as that ulcer gets infected, it will start to turn a cloudy white color. And depending on the response of the calf, this could become really devastating. The ulcer continues to spread and almost kind of melt away, if you will. The eye turns completely cloudy and white. And then ultimately the calf could lose the eye. It either ruptures or it kind of bulges out. So it's a nasty disease. If we catch it early, that, like I said, I'll repeat, that's our best chance of getting that disease.
One telling sign I've seen in the past, and it's not like we've had a lot of rain around. We're still pretty dry and dusty. We have fires going on everywhere. But one thing, when you get that initial tearing, and usually if you can see it in both eyes, a lot of times you'll get a dust mat on that in this dry, dusty weather. So that tearing, if you see dusty faced calves and it's just kind of a big dirt mat right below the eye going down, is a sign that they've been tearing, and that dust has settled on those tears is a good thing. I saw north central Kansas on here, and I know we haven't had a lot of rain in south central Kansas either. So those are some of the first things you can catch right away and see that you have a potential issue. You brought up a great point about grass awns. I mean, I think if you take a gloved hand and just sweep through there's been many times you can just pick a grass awn, a goat awn out of an eye and realize that's what's been causing the issue. So it's a simple thing to do. But also, if you see them matted with dust on both sides of the face, then you're probably getting a bacterial, viral, some type of infectious process going through them. So it's good to take a close look at those calves. You can also help diagnose them a little bit, because you're going to diagnose them from the truck or the horse to start with, right? I mean, you're going to go out there, you're going to see them, and they're going to be squinting, they're going to be off, and those are key things to pick up that we need to, as cattle producers, be cognizant of all times. Yeah.
Yeah. So, Dr. Moore, what products do you at Norbrook carry that would be effective treatments for pink eye?
So our big one is, in the past, the go-to standard to treat pink eye has always been oxytetracycline. And the one that we have that has a 300 milligram oxytetracycline, we actually have a 200 milligram oxytetracycline, and all the difference is with that 300 milligram oxytet, you can give a lower volume of a dose at a time, so you don't have to put as much product in to get the same effect. So our Noramycin 300 that we talked about at the beginning of the show, or beginning of the feed, is an excellent product for pink eye treatment. If you run into issues, you can always swab and see what you have. But I think most of our issues isn't what product we use as much as when we use them, getting them there early and getting treated early and getting on top of them right away. I do like your mineral feeder and have seen that work successfully. We have a lot of fly tags. People put in fly tags, and they usually put them in when they work cattle in April, right?
Yeah.
Or when they put them in now, and then when they have the most effect, and then we get out in June and July, and then we have a lesser effect because they've put product out that whole time. So having something that you can get those cattle later on in the fly pressure time. And one other thing I'll mention about flies is flies don't pay attention to fences. And so your neighbor's fly control can affect the effectiveness of your fly control. They don't, I've never seen a fly ready fence yet, that will hold flies on the other side, right? So you'll have those can travel with to your herd. And so when you look at your fly control measures, having something that you have your peak fly control at the time of your peak fly pressure, and then have realization of what your neighbors have for fly control too. You might, if you have a good relationship with, you might say, hey, I'm fighting pink eye. I don't want them to come over your herd. We need to knock down the flies on both sides. And so knowing that can be another pain point in the whole process is critical to look at too.
Yeah.
We've had fly control problems, just like you've had vaccine programs you put out there that people can blow right through and make fail. Fly control is the same way.
Yeah, fly control is challenging.
Yeah.
So, yeah. Does anybody have any questions? We haven't seen any pop up in the comments here. We'd be happy to field any questions as you guys think of them. It often is better if this is more of a discussion rather than just a monologue for me and Dr. Moore. So please, if you have questions, put them in the comment box. So that's pretty comprehensive discussion on pink eye. We covered a lot of topics there, a lot of information. We can kind of switch gears now to foot rot, and that's a challenging disease as well. Sometimes it gets misdiagnosed. If you see a limping animal, a lot of times you'll just call it foot rot when it's not always the true foot rot. The true foot rot is when they get an infection in between those toes. And I did see a question pop up there. So we'll kind of pause here our discussion on foot rot from Janelle, the best preventative product for pink eye. And there it pops up for everybody to see. That's a good question, Janelle.
Dr. Tony, I'd start out with the one that works, right?
Yeah.
And identifying the one that works for your herd is the tough one.
Yeah, it's a challenge. Like Dr. Moore alluded to there are many different kinds and many different strains of bacteria that can cause pink eye. Our big ones are Moraxella bovis, and there's a lot of different strains of that. There's some new bacteria that they're discovering are involved in the process that really aren't included in very many vaccines. So it can be a challenge. And like we mentioned early on, vaccines in and of themselves, even if we nail the strain, they don't provide excellent control of pink eye. They do help. They do create some immunity, but they don't provide excellent control. So,
Dr. Tony, even if the vaccine doesn't always prevent disease, prevent the disease from happening at all, it sometimes will lessen the severity of it, right? And so if you have a baseline pink eye vaccine program with a commercially available pink eye vaccine, and that would be one I'd kind of, talk to Dr. Tony or myself, or talk to your local veterinarian and let them kind of help. They have an idea what's working and what's been used in your area. But you really want to look at it. It may not completely eliminate disease, but if it slows down the severity and progression of it, it gives you a chance to treat it and save the eye and lessen that amount of damage that's being done to that calf. But I'm sure you've seen that as well, Dr. Tony, and that's one. So if I get asked for a vaccine recommendation on a preventative product, it always goes back to what works best in your herd. And then you can kind of get an idea about which ones you have available that you can order and look at and talk to Dr. Tony or talk to your local veterinarian about which ones to start with. But the key is to have one in place if you have pink eye problems, and then build up from there.
Yeah, good points. Next question: any supplements help to fight flies, such as garlic? Yeah, I've seen garlic being used for fly repellent. It does help. It's not going to be a sole fly repellent, but as a combination, it can provide some benefit.
I would agree. I've seen some. I haven't used a lot in myself. We were just having a conversation about that on, I think it was our bovine practitioner listserv was just going over that. I don't know if you saw that. And so they were talking about the benefits of garlic. And so I think, as Dr. Tony mentioned so eloquently in the very first part of this conversation, vaccines, garlic, fly control are all part of a preventive program. There's not a silver bullet out there that'll stop that you can use to look just end the problem. You have to look at the whole situation holistically. And if we talk about that triad, we mentioned the animal, the pathogen, and environment, you really have to work on all three levels to get a good preventative program.
Yep. Okay. Well, if there's no more questions, we'll go ahead and shift over to foot rot now. We kind of started the discussion, and we were talking about what classic foot rot really is. It's not really, any limping cow. It's not automatically foot rot. Foot rot's an infection between the toes, and up in that tissue between the toes is a soft part of that foot. And if that gets scraped or soft, due to standing in water, then it can get infected. And that's what classic foot rot is. There's certain bacteria that cause foot rot, and it is a treatable disease if it's caught early. That's the key. Just like pink eye, we need to catch these diseases early. We need to get them treated. So preventative measures, it's really just preventing any kind of trauma to that part of the foot. So removing rocks and dirt clods and things that they can scrape that foot on, rough concrete areas that they can cause trauma. It's a challenging disease to prevent because they're cattle. Cattle will be cattle, and they're going to get themselves hurt. But the key is checking those animals, catching that limping animal, and then getting them treated early.
If we look at the herds in general, and we have people from Pennsylvania to Arkansas to Colorado on here, I would ask in the chat, how many people are above their average rainfall right now? And I guarantee that we probably don't have many people above, if you look at the drought monitor, above our average rainfall. And so one thing that affects the integrity of that hoof, like you mentioned, Dr. Tony, you're spot on, the integrity of that skin in between those toes, where we get the common entry portal for infection, is when you have cattle in drought-stricken areas. And I know my pond on my pasture is about 4 feet below normal. you know, and it's not, and the cattle have to walk through mud and they have to walk through new areas. And even something simple as having all those dried up hoof prints as the ponds get lower that provide a point where they step in them and they ram that dried holes up in between those toes can lead to more damage that can cause more cases of foot rot. So we talk about, again, that triad, those three things going on. You may have a period of time like this year where you'll see increases of those cases where they have the infection between their toes. That could be a function of really a drought, right? You know, that they have. So I just got told they're standing in water everywhere in northern Ohio right now. So that's one that, so they can have, that can be the opposite too. It can be so wet all the time that it allows that penetration. So it can be either end of the extreme, can set them up for that Fusobacterium microphorus or Bacteroides meningitis, you know, that could get in there, and both those bacteria are present and can get in there and cause foot rot. And again, getting them treated early is the key.
Yeah, yeah, yeah. Dr. Moore brought it up, and he mentioned standing water. And think about this: if you're in the pool all day or you're in water, your fingers get all wrinkly, and that same thing happens to that tissue between those hooves. And it makes the tissue soft and makes it easier to injure, makes it easier for that bacteria to get up into it. So classically, foot rot does follow periods of time where it gets really hot. The cattle are standing in the ponds for long periods of time. That can set you up for a foot rot outbreak as well. So symptoms of foot rot, you're going to see limping early, and quickly after that, it's going to start to swell. And it'll be swelling that's what we call symmetrical. It's going to be the same size on both sides over both hooves, okay? And as the disease progresses, that swelling will start to travel up the leg as that infection does. So when those limping cattle are first seen, it's always a good idea to get them into the chute, get that hoof lifted up, and look for reasons on why we're seeing the limping. Just like what we've brought up multiple times, treating it early is going to be the best.
And using an antibiotic that has a good coverage for those, you know, those bacteria and has good penetration down in that tissue. And so, you know, one that we utilize a lot is our fluorophenocal product, Norphenacol, has a foot rot claim on it, and it's one that gets in good penetration in those tissues. If you're going to have one product on the farm, you're going to be looking to treat both pink eye and foot rot. The oxytetracycline 300, you know, normycin 300, it would be a good product that's labeled for both and does a good job on both as well. So having that one tool in there. The other thing you sure want to do, because I've been fooled by it before, is if you have one that you treat or you have it up to treat, pick up the foot and take a look at it. You know, how many times have we seen even just a locust tree thorn stuck in between that toes, or pulled a piece of baling twine. I've had a piece of baling twine wrap in there that we pulled out that just cinched down over time, that can cause that. But to your point, Dr. Tony, those will be more asymmetrical or just one side, as opposed to that symmetrical swelling on both sides. But they have to also be picked up and treated, right? So
yeah, typically they will be asymmetrical, like you mentioned. The other benefit to picking up the hoof, even if we are fairly certain on what's going on, is I do believe that topical treatment is worth it with foot rot. We can clean out that tissue that's starting to kind of necrose and fall off. We can clean out the mud and dirt that's packed up in there. And then we can apply some topical products to kill those bacteria topically. So that will complement your injection of antibiotics. It won't replace it, but it will complement and increase your treatment success.
absolutely, because you're going to have bacteria on the outside, bacteria on the inside, and a lot of those will break open and drain sometimes too. And so getting that flushed out and getting all you can out of there is critical to get them back to their peak performance right away.
Yeah. Okay. Well, again, if you guys have any questions about foot rot, we'll be happy to talk about them here. If you have any questions related to cattle health, spring, summertime that are separate from foot rot or pink eye, we could sure discuss some of that too today. We have some time here. So if you guys have any questions, please put them in the box.
You know, Dr. Tony, if we look at pasture robbers in general, I think we hit the major ones. You know, pink eye and foot rot are the ones that cost us the most. You can't iterate enough, that you can't emphasize enough the fact that pink eye is going to cost you in gain and cost you at the sale barn. I mean, you get a wide eye on a calf, we know they're pulling them off, and you're talking 5 to 10, 100 back easy. Yep. On that from what you would have got otherwise. So that makes that prevention look cheap when you don't get paid. And plus, they're going to be lighter, usually 50 to 75 pounds lighter than the rest of them that didn't have pink eye. So it really can be a profit robber in that pasture time for you. I mean, it really can make a difference.
Yep, it sure can. Yep. So another big one, guys, another big profit robber when we're out at grass is summer pneumonia. And vaccine protocols are important when we're talking about pneumonia and bovine respiratory disease prevention. So it might be worth a discussion with your veterinarian, or you can call me and have a discussion. We can talk about how we want to vaccinate these animals going out to grass, how we want to manage them so that we can minimize the risk of those diseases from catching hold. So I do recommend vaccinating calves going out to grass, young calves that are born in spring. Modified live respiratory vaccine, a viral respiratory vaccine is important, as well as a black leg vaccine. So lots of different products to choose from. And like I said, that is a good discussion to have with a veterinarian to try to minimize the risk of that summer pneumonia, and also to help build that immunity for weaning time so that we can have that immunity that we booster around weaning time.
Yeah. Looks like Marna has a question from her husband. Is all
pink eye the same? I'll let Dr. Moore tackle that one.
Yeah, great question. So no, it's not. And that's a big diagnostic thing we need to look at. So we have viruses that can affect that. Majority of them are bacterial. And then we have other trauma that we have, you know, is there weed-ons, go to odons, and then get in there. So it's not all the same. Fly control is big. So you have to start a baseline program to try and prevent it. But the one thing is, short of the traumatic pink eye or foreign object stuck in the eye, treatment is pretty much relatively the same across the board. You're going to hit them with an antibiotic, injectable antibiotic. There are some topical treatments that people will use too that are beneficial, both as an ancillary treatment or additional treatment, and some have been tried as a standalone. Usually you can use both of those and get a quicker response. But no, all pink eye isn't the same. Marna, great question. So
yeah, that is a good question. That's an excellent question. I might add on there, I do think it's important to cover the eye if you've got an eye patch.
Yeah.
2 reasons. It keeps the sunlight out, keeps the grass from poking it again. So it lessens irritation. It also helps to minimize spread, keeps the face flies away from that infected eye so they can't pick up that bacteria and travel to another animal.
I've done a couple different things in the past to cover that eye, both a patch and then a third eyelid flap too. Both have worked well. The key is protect that cornea from any further damage on that. Now, Janelle had an interesting question. We had cattle with a friend. We both used pink eye preventive medicine. Our calves had more problems with pink eye than our friends. And so, you know, that's the one thing we didn't mention as part of that animal part of the triad, the calf part of the triad. We talk about their immune system all the time. We don't always talk about genetics. And even white-faced calves, pigment in calves' eyes can make them more susceptible to pink eye. I mean, I assume I'm not saying that's the case necessarily here, Janelle, but if we look at calves across the board and we look at pigment around the eye, lighter pigments seem more susceptible as absorbing and protection from UV radiation, which is a contributing factor to pink eye. So cattle that are in shade more may not have as big a chance of getting it, but it builds up to just there's a myriad of factors that tip over and get above that threshold to cause disease to take place. And we never know as veterinarians how close we are to that threshold. So we're trying to take that threshold of disease and do everything we can with all our preventative measures to open that gap as far as we can.
Yep. Yep.
And so Janelle's not helping me on my answer here at all, because hers were Angus and theirs were Charolais. So the pigment thing is there, but a difference in genetics can play a difference. And so even beyond just pigment around the eye.
Yep. Yep. Genetics as far as the immune status of that animal and their resistance to those diseases. So yeah, excellent point, Dr. Moore. Mandy asks, we just have one cow right now. We fed her fenbendazole pellets for horses in her feed bowl. Was this okay? I'm new to cattle. Yes, that's okay, Mandy. Fenbendazole is commonly used in cattle. It would be an extra label use of it. So your veterinarian should have been involved in that, technically, according to the way the laws are. I can't make any extra label recommendations, but I know that fenbendazole is safe for cattle. And as long as you got the correct dosage into the animal, then it should have been an effective deworming as well.
Yep. Now, it is probably prudent to point out that not all things that we give cattle are safe for horses, and not all things we give horses are safe for cattle. And so you want to make sure you stick with the labeled product, because they can be deadly for other species, right? And so, so that's a great point. Being new to cattle, it's really a good idea, even with one cow, to talk to Dr. Tony or talk to your local veterinarian or find your animal health source to make sure you can, number one, locate a supply for the things you need, and number two, understand what you're giving those animals, because there are some cases where it can be deadly by using products labeled for cattle, and especially products labeled for cattle and horses, like rumensin toxicity and things like that. So yeah, across the board, it's best to know before you do it.
Yep. Is feed through fly control a good option? Yeah, good question. Feed through fly control is a good option. It's not going to be effective by itself. So just a little background here, feed through fly control, you feed it to the animal, and then the ingredient travels through into the manure of the animal, and it prevents larvae development in that pile of manure. Now the animal has to consume the correct amount every day for it to be effective. And then also, Dr. Moore hit on it earlier, flies don't stop at the fence line. So flies that develop at your neighbor's house or 5 miles down the road, they're going to travel, and they can travel fairly long distances, and they can fly onto your property. So it might not look like it's having an effect, but the products themselves are effective at preventing that larvae from developing.
Yes, I mean, that's a great point, Dr. Tony, is that with that feed through IGR, insect growth regulator, in those products, they're gonna affect the next wave of flies. You know, you still need something to knock down your current fly population, whether that's already there or came from the neighbors, right? So,
Yeah.
Great point.
Yeah. Okay. Well, if you guys have any questions that you think of later, please put them in the comment box, and I'll go through and review those questions and respond to them. So,
one other thing about fly control I just thought of, when historically, when we look at our deworming programs, and we look at breakdown of fecal mats, or, where flies overwinter at, dead feed material, just overall taking care of those places where flies can overwinter and be present to populate next year's is another factor you need to look at too. And so dead and rotting feed patches, manure pats, people drag pastures to break those up so they don't have a place for flies to feed or grow in the next year. So we talk about the holistic approach to the environment. That also includes just mechanical things you can do too and to address the environment. Cut down odons, take care of those types of things that can cause traumatic damage. So there's a lot of things.
Yeah, absolutely. Candace asks, how early should you start feeding fly-through products before fly season starts? Yeah, good question, Candace. So, like you mentioned, you can have overwintering of flies. You would want to start feeding it as soon as you start seeing flies. You don't have to feed it before you see flies. It's not going to hurt anything. But as soon as you start seeing those flies, they're going to start laying eggs. And so you want to make sure you have that into the feed through products.
Yep.
Okay, well, I'll turn it back over to our hosts here and they'll pick 2 lucky winners.
Well, first of all, we want to say thank you to Dr. Tony and thank you to Dr. Moore for helping us out today and for answering all these questions. 2 lucky viewers are going to receive some Noramycin 300. Melanie.
All right, the first winner is Susan Hay.
Yay!
And the second winner is Mandy Fleming.
Congratulations. All right, just a few other announcements before we let you go.
Before we hop off here, I want to remind everybody that our Spraymaster Spectacular is still going on. You have until June 24th to get signed up, so sign up now so you don't forget.
And join us again next Wednesday live. Dr. Tony's going to be back with us, and we're going to be talking about arthritis in pets. So make sure you tune in for that. Thank you again, Dr. Moore. Thank you, Dr. Tony. We'll see you all next Wednesday.
Bye, everyone.